Time now is 10 minutes to 7. Hospitals are braced for a huge rise in patients turning up in A&E this weekend as pubs and bars reopen. They're being warned to prepare for the same kind of levels of drunken people as they would see on New Year's Eve. That's according to an email seen by the Health Service Journal. Well, we can talk now to Dr. Katherine Henderson, President of the Royal College of Emergency Medicine and herself an emergency medical consultant at St Thomas's Hospital in London. Good morning.
Good morning.
So some people really looking forward to the pubs and restaurants opening up, but I guess you and your staff are dreading it if these warnings are to be believed.
We're bracing ourselves, I think would be a fair way to say it. We hope that people saying it's going to be like New Year's Eve doesn't mean that it becomes like that people go, oh, right, we ought to be celebrating. Actually, I hope a lot of people will feel fairly cautious about what they do this weekend. But it actually is quite serious. We have got emergency departments that are having to work in a very different way than they did before because we have to be able to keep vulnerable patients safe. And so we can't have crowded emergency departments. It just doesn't work from an infection control point of view.
Particularly, I guess, if people have had something to drink and maybe less disciplined when it comes to social distancing?
Exactly. So there's sort of two risks. There's the risk, out in the pubs area, but there's also the risk in the emergency department. People's ability to social distance will be reduced if they're not as aware of their surroundings as they should be. And in the emergency department, there is the risk that then we'll start getting patients infected who are there because they've got some serious underlying health condition, but where they're now in an environment where there are a lot more patients or a lot more people who could pass on infection.
And I'm sure you are separating out coronavirus patients from others, but do you think there's still a risk of infection?
So we are still separating out patients who present with symptoms of coronavirus. The problem is, and particularly with the young, is they can be asymptomatic. They don't know that they've got it. So they pass it to someone else, and that person may have underlying health conditions that they don't know about. And there's no reason why they should know about them. So we're trying to shield people. But what we can't do is have a department that gets overwhelmed by people who are injured because they've got themselves into a fight, they've fallen off something, they've drunk so much that they actually need health services help. You kind of go, people have been standing at doorways clapping the NHS. Well, more important than clapping the NHS is using the resources responsibly. And anybody who goes out and gets so drunk that they need an ambulance and they need to come to an emergency department is not supporting the NHS.
Dr. Katherine Henderson, President of the Royal College of Emergency Medicine. Thank you.